A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a landmark announcement that has sent ripples through the political landscape, Prime Minister Sir Keir Starmer has declared the abolition of NHS England, the independent body that has overseen the National Health Service since its inception in 2012. Speaking during a speech in Hull, Starmer outlined his vision for reforming the NHS, emphasizing the need to eliminate layers of bureaucracy and redirect funds to frontline services. The Prime Minister stated, "I can in all honesty explain to the British people why they should spend their money on 2 layers of bureaucracy. That money could and should be spent on nurses, doctors, operations, GP appointments." With this bold move, Starmer aims to bring the management of the NHS back under direct governmental control, arguing that it will enhance efficiency and accountability. NHS England, which employs approximately 13,000 people and manages budgets for a workforce of around 1.5 million, has been described as the world's largest quango. The organization was established under the Conservative Liberal Democrat coalition government a decade ago. Starmer's announcement comes in the wake of significant criticism regarding the NHS's performance, including long waiting times and low patient satisfaction. Health Secretary Wes Streeting echoed these sentiments, calling the abolition of NHS England the final nail in the coffin of the previous government's disastrous reorganization efforts. Streeting emphasized that the current structure has led to the longest waiting times and the most expensive NHS in history, stating, "When money is so tight, we can't justify such a complex bureaucracy with 2 organizations doing the same jobs." He further elaborated that the reform would streamline operations, allowing resources to be devolved to the NHS frontline where they are most needed. The announcement has sparked mixed reactions across the political spectrum. While Conservative Shadow Chancellor Alex Burghart expressed cautious support for the measures, he warned that Labour must now take full responsibility for NHS performance. The Liberal Democrats welcomed the move but cautioned that addressing the crisis in social care is equally critical to improving NHS outcomes. Unions and health bodies have raised concerns about the potential impact of this reorganization on staff morale and patient care. Unison General Secretary Christina McInerney criticized the handling of the announcement, stating that staff would be left reeling from the news. She pointed out that just days prior, NHS England employees were informed of impending job cuts, only to learn that their entire organization would be dissolved. The transition to a new structure will be overseen by interim CEO Sir James Mackey and incoming NHS England Chair Dr. Penny Dash, with a timeline of approximately 2 years for full implementation. Critics of the move, including health think tanks, have expressed concerns that another reorganization could distract from the primary goal of improving patient care. Hugh Alderwick, Director of Policy at the Health Foundation, warned that past experiences show that restructuring often leads to disruption rather than the anticipated benefits. The potential savings from this reform are estimated to be around £500 million annually, a figure that some experts argue is minimal compared to the overall NHS budget. As the government prepares to navigate this significant change, the focus remains on ensuring that the health service can deliver timely and effective care to the British public. Starmer's commitment to cutting bureaucracy and refocusing on frontline services reflects a broader trend in political discourse, where efficiency and accountability in public services are increasingly prioritized. However, the implications of this decision for NHS staff and patient care will be closely monitored in the coming months as the government embarks on this ambitious reform journey. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.